All right, we're now streaming live on YouTube. Welcome everybody to our media briefing. It's Friday, May 29th. Today we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, as well as Regional Chair Karen Redman. And once again, we have Mike Murray here, our Region of Waterloo CAO, to answer any questions. So we'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Okay, thank you. Thank you. So the number of new cases continues to stabilize or decrease in our community. As of 8:30 a.m. this morning, our dashboard reports that approximately 6.1% of people tested in Waterloo region are testing positive for COVID-19. To date, the total number of COVID-19 associated deaths remains at 113. Of these, 93 are associated with long-term care home or retirement home outbreaks. A total of 797 cases, or 73% of positive cases in Waterloo region, have now been classified as resolved. There are currently 189 active cases, of which 86% are isolating at home or in their congregate setting home, and 13% are in hospital at this time. 3 cases are still under investigation. The signs remain tentatively positive, but delicate, and we will need to closely monitor. We are not out of the woods yet. Beginning this weekend, our dashboard will no longer be updated on Sundays. This to give staff a little bit of a break. The dashboard will continue to be updated Monday through Saturday at 10:30 a.m. with the data from 7 p.m. the evening before. This continues to be a difficult time, and as businesses begin to open, new concerns are emerging. It's normal to feel anxious or stressed, but there are a few things we can do to help manage our stress. Taking care of ourselves, staying connected with friends and family, eating well, being active, trying to get enough sleep, taking breaks from the news and social media, being mindful of information overload, and seeking information from reliable, trusted sources. Focusing on what we can control, such as washing our hands often, keeping 6 feet between ourselves and others when we leave our homes, and wearing a non-medical mask whenever there might be a risk that we cannot maintain physical distancing from others. It's also important to recognize when we need additional support. Support services and resources are available on our website. And if we find ourselves feeling like we're in a crisis, we can call here 24/7 at 1-844-437-3247. Remember, asking for support when we need it is not a sign of weakness. It is a sign of strength. Your efforts and sacrifice are making a difference in our community, but we must not let up now. Please continue to practice physical distancing at all times and wear a mask when you could be in close proximity to others. Let's continue to take care of each other. Our path forward needs to remain slow and measured because moving slowly is ultimately the fastest way. Where we go from here will largely depend on the actions all of us take as a community. Waterloo region is a caring community. It is a strong community. Let's continue to show that we are. Thank you.
Thank you, Dr. Wang. We'll now hear from Regional Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. Good morning, everybody. Today, I want to bring Family Compass WR to your attention. Community organizers and groups across Waterloo Region have been working together to help children, youth, and families during this challenging time. Family Compass WR helps to connect you to community-based services and supports for parents, youth, and children in Waterloo Region. It's updated regularly and currently includes a wide range of topics from mental and emotional health, government resources to a calendar of physically distancing friendly events. It's a great resource for families during COVID-19. Visit familycompasswr.ca and click on COVID-19 response link. I truly believe everyone in Waterloo Region wants to do the right thing and keep each other safe. Thanks to you for your continued efforts. Our numbers are encouraging. As we head into the weekend, we must continue to practice physical distancing. The weather forecast certainly looks promising, and I encourage you to find some time to get outdoors and enjoy fresh air for your physical and mental health. But I ask you to be wise about where you go so that you do not run into crowds. We're not yet at the point where households can mix. Please do not socialize in group settings, especially indoors. Driveway or porch visits are okay, but please remember to keep your distance, wear a mask, and keep your hands clean. Our collective hard work will pay off and Waterloo Region will safely and gradually reopen, but we will all have to keep doing our part. So please continue to practice physical distancing in everything you do. Let's not give this opportunistic virus any more chances to spread. Have a great weekend, everyone. Thank you.
Thank you, Karen. We'll now turn it over to questions, and a reminder that Mike's also here to answer any questions you might have for him. We'll start with Joanna from the Record. Go ahead, Joanna.
Great, thank you. A couple questions for Dr. Wang about Forest Heights. I understand that Public Health was visiting there yesterday with provincial officials. Can you tell us more about that visit and what was the purpose?
Yes. Public health staff, as well as staff from the Ministry of Long-Term Care, were visiting Forest Heights, and we've done that before. As I had previously mentioned, there have been healthcare partners providing support to Forest Heights, given the size and scope of their outbreak. Yeah, that's part of continuing to provide the support and helping them with, ensuring that the measures that they're putting in place continue to be what they need to have in place. So it's a local response. It's not a provincially directed thing that we did yesterday. It's continuing what we've been doing so far.
And after being there yesterday, how do you feel about the situation at Forest Heights? Because I know it's an area of concern for a lot of people in the community.
Yeah, no, I agree with you, Joanna. It's an area of concern for health system partners and myself included. This is a very, very large outbreak. What we've seen in terms of the evolution to date is that we've seen the outbreak, over time come under better control. And I think you've seen that with the numbers as well. With these very large scale outbreaks, it is very difficult to quickly bring under control. We just have to continue with the efforts, continue to work with Forest Heights and their Rivera management to ensure that things continue to go in the right direction. But it's not an easy thing to do when an outbreak is that large.
And how would you characterize the outbreak now?
I would characterize it as coming under control, but we can't let up in terms of the vigilance, and we have to keep monitoring every day.
All right, thank you. Those are my questions for now.
Okay, thank you, Joanna. We'll turn it over to Kate from CBC. Go ahead, Kate.
Thank you. Yesterday, Minister Fullerton was talking about how some homes are red, some are yellow. Do we have any code red homes in the region? Would Forest Heights be one?
Yeah, thanks, Kate. So it's actually called red, not code red. Health system partners every day actually talk about the supports that they need to be providing to certain homes. And as you can see, Forest Heights is one of them. And, we have classified Forest Heights as a red home, meaning, it's a very large scale outbreak, and it continues to require significant resources from the health system partners to continue to help it be managed and come under control. So, if Minister Fullerton is talking about those reds, then yes, Forest Heights is the long-term care home in Waterloo region that health system partners have classified as red.
And it's the only one?
It's the only long-term care in our region that's been classified as red.
And do we have any that are considered yellow?
Yeah, we have one long-term care in our region considered yellow, and that's Trinity Village. Again, it is related to the size of the outbreak as well as the need for continual supports.
Thank you, Dr. Wang. And I have a question, I guess this would be for Mike. Hi, Mike. With transit starting back up on Monday for fares, is there anything, I know we've talked about this, but is there anything riders need to know about when service may also be coming back up to the regular levels that people might expect it to be at?
Yeah, so that's a good question. So we're continuing to monitor transit ridership, transit usage, and the loads on buses on different routes. And so, we'll try to manage transit service to manage the loads on occupancy loads on buses on different routes. So I think this is going to be a kind of dynamic and evolving thing. As ridership climbs back up, service will climb back up, kind of in lockstep.
And is there anything else people need to sort of keep in mind for Monday? Things like other than have money and pay?
We strongly recommend that people wear masks. And that's, consistent with everything that, national and provincial and local public health officials are recommending. And the region and GRT are recommending that as well.
Yeah, I agree. It's an environment where it's not easy to ensure you can maintain physical distancing. I definitely recommend it.
Yep. So front door boarding and wear a mask.
Great. Thank you. Those are my questions for now.
Okay, thank you, Kate. We'll move on to Damon from Woolwich Observer. Go ahead, Damon.
Okay, I just have one question here for Dr. Wang. It says the outbreak at Conestoga Meats is declared over. Does that mean all the cases have resolved?
No, it doesn't mean all the cases have resolved, but we have to date 80 cases that have resolved. And so that's good to know. We've declared the outbreak over because we've seen a significant decrease. I'm sorry, it says I'm signed out of Zoom. Just gonna try to, can you hear me still?
Yeah,
Yep.
you're still there.
Okay, great, I just got a message, I'm signed out of Zoom. So we have declared the outbreak over because we have seen a significant reduction in the number of new cases. And, we have seen that the outbreak has come under control, and we don't have evidence that there is a continual source of risk or spread happening in the workplace.
Okay, great. That's all my questions for today. Thank you.
Okay, thank you, Damon. We'll move on to Tim from 570. Go ahead, Tim.
Good morning. So we were sent pictures of long lineups when stores opened with nice weather, and nobody was physical distancing, and
Mm,
stores weren't enforcing it. What's the message to stores about social distancing? And this could be for anyone.
Yeah. So yeah,
mm,
Tim, I'll give you a sort of an overview. Um, I'm going to say we, our enforcement partners, so regional bylaw, local bylaw, public health inspectors, did get questions, concerns this week about lineups at stores. And so police, bylaw, and public health responded. They investigated. What they found was appropriate health protection measures were in place. They didn't have to take any enforcement action. They did do sort of ongoing, education and awareness. And so they'll continue to reinforce the need for physical distancing, outside of stores, within stores. Most stores have, very clearly defined protocols around physical distancing, both as people enter and for sort of traffic management within the stores. So we'll continue to, I'm saying all the enforcement partners will continue to reinforce that with retail outlets, and we'll continue to respond to questions and complaints as they come up.
Okay, and Dr. Wang, we've seen an increase in testing. Is this a good trend?
yeah, it's definitely a good trend. So we're seeing an increase in testing, and we're seeing numbers either stable or decreasing. So that's definitely a good trend. But really, I need to remind people it's not the time to let up. Please continue to follow the recommendations, because there's always a lag when we get reported cases and when people get infected, right? And so people have to continue to take measures so that we don't see 2 weeks down the line an increase in cases because people haven't been taking measures. It's really important, especially when it's really nice outside and, people have this fatigue of staying at home and not being with others. So just a reminder. And I think Mike wanted to say something.
Yeah, and so I'll just add, having listened to a number of Dr. Wang's reminders, the other reminder that I would add is a negative test is just a point in time. And, it is not a replacement for all of the other protective measures that, public health continues to recommend. Physical distancing, avoid large crowds, good personal hand hygiene. That's all critical, because negative test today does not talk about anything about, tomorrow or the next day.
Okay, and then with one new case today, is public health seeing a trend with this, or is this an anomaly, especially with the curve slowly increasing as it looks relatively steady at the top on the website?
Sorry, I'm just going to pull up the website so we can take a look together. So there's two curves, and in terms of in terms of I think the curve you were speaking to is this curve, which is the cumulative curve. So that's never going to go down, because every time you have an additional case, that just adds to the curve. That's always going to be a curve that's going to grow, so to speak. But we can see that flattening. And that is a result of what we see from this other curve, which is based on the date of onset of symptoms of cases, or if they were asymptomatic, the date that their test was taken. So what we can see here is that there is definitely a slowdown, a decrease in the number of new cases that are starting to appear over time. And, there also seems to be a bit of a stabilization, at least, and possibly a decrease that we've recently started to see in the number of cases that are community associated as opposed to associated with outbreaks. So we'll have to see. I mean, these are obviously promising signs. These are good signs, but we'll have to closely monitor, because in recent weeks, this is when we've also started to see restrictions relaxed, and more people continue to be out with others. And Yeah, so that's why I keep saying, I know I keep saying this, but that's why I keep saying the situation is precarious, because we are seeing this decreasing trend, or at least this stabilization in community cases. But we're also opening up and more people are interacting with each other. And there's always a bit of a delay in terms of when we start to get the cases reported to us. So that's why, everything we do now, everything we do today and this weekend, that's going to affect our curve in the future. So hopefully that helps.
It's great. Thank you.
Okay, we'll move on to Nicole from CTV. Go ahead, Nicole.
Good morning. Can you guys hear me?
Yes.
Okay. In regards to Forest Heights,
Yeah.
yesterday's visit, we know that the province announced, inspections of the 13 red homes. Was that one of the unannounced inspections?
I don't think so, because those are inspections that are going to be conducted by, well, to be fair, I'm not sure, because those are inspections that I understand will be directed and carried out through the Ministry of Long-Term Care with their Ministry of Long-Term Care inspectors. We have already been working with the Ministry of Long-Term Care and their inspector for Forest Heights as a group of health system partners. So, what's been happening in other places could vary a little bit, right? Here in our region, for a number of weeks now, we've been working together as health system partners, and we've also worked very closely with the Ministry of Long-Term Care. So we've conducted, site visits before, and we're continuing that. So there might be some additional visits that the Ministry of Long-Term Care is wanting to do, like you mentioned, unannounced, unplanned. I don't know about those. I can just talk about what we're doing with local health system partners.
Okay, thank you. And yesterday, Premier Ford mentioned that some inspectors refused to do on-site inspections. Did any inspectors refuse to do on-site inspections of any facilities in Waterloo Region? And are you aware of any over-the-phone inspections in the region?
I would need to refer you to the Ministry of Long-Term Care for that one, because what the Premier was talking about was on-site inspections by the Ministry of Long-Term Care inspectors. I knew that's a bit confusing, because we also have public health inspectors and other inspectors, but he's referring to Ministry of Long-Term Care inspectors. So that I would need to refer you to the Ministry of Long-Term Care.
Okay. In terms of right now, there's a technical briefing in regards to testing strategies for the province. If we have questions about a new testing protocol, can we reach out this afternoon for an answer if, in regards to what's happening locally?
Yeah, I'll be interested in finding out what that briefing says as well. Again, if it relates to testing, that is overseen by the assessment centers, unless the province announces testing that's going to be overseen by other partners as well. I'm not sure what will be announced, but in general, the testing is being done and overseen by the assessment center. So we'll have to see what's being said, but if it relates to testing that can be done at the centers, then it would be the centers that would be best equipped to answer.
Okay, but you are in partnership with the assessment centers, though. You have some knowledge, so
I would know. I would know what we learn all together at the press brief or the technical briefing at 11:30. So I'm very interested to know as well, and I definitely would support the partners in terms of, trying to encourage people to get tested.
And in speaking of testing, like obviously we've seen the numbers up this week. Can you tell us what's changed in testing this week to give us these levels of new tests?
The province has opened up the eligibility criteria. So they have opened it up in, in their terms to people who either are symptomatic, as has been the case for a little while now, as well as people who are concerned they may have been exposed. So that's what they've given in terms of criteria. And, people are able to make the self-assessments if they fit into one of the categories. And now, in our region, there's no need for a referral. They can self-refer to any of the assessment centers for testing.
We spoke with a woman earlier this week. She tested positive and she's asymptomatic. Are you separately tracking them, and will there be, will this be highlighted in the dashboard separately?
No, all the positive cases, wherever they took their test, even if they took their test outside of their jurisdiction, if they reside here, they're counted in our case count. And so all the positive results come to public health, and we do case and contact follow-up for every one of them.
But will we find out, like, if they're asymptomatic, is there going to be a special bar that will show that these people are not showing symptoms?
No, it will just be counted as a case. Yeah, I mean, you'd have to look into the history to determine, what, just like for every case, you have to do a specific case follow-up to get more information about where they could have acquired the infection, things like that. But they are considered a case just like anyone who is showing symptoms. They're considered a case. I don't know if I'm answering your question correctly, but they're not going to show up separately. They're going to be part of our case count.
And my final question is for Mike Murray. You said you're recommending that, transit users wear masks in Ottawa. However, Ottawa Transit has made it mandatory for their users to wear masks. Are you considering a similar policy?
Yeah, it's a really interesting question, Nicole. And one of the things that we and other transit system operators are, I think, kind of actively looking into is whether we can actually make it mandatory. That's a bit of an open question. Whether we could refuse to take somebody on transit if they weren't wearing a mask, because there are some people for whom it's actually very difficult for them to wear masks. So it's a bit of a complex issue. So right now, we're strongly recommending that people do, and it's an active issue, within GRT and with other transit systems. I don't know if Dr. Wang wants to add anything on that.
No, it's true what Mike has said. For some people, it's very difficult to wear a mask. I see that as definitely an issue that needs to be considered. But a lot of people can wear masks. And if a lot of people wear masks, then a lot of people are helping to protect each other, including those who can't wear masks.
Okay, that's it. Thank you.
Thanks, Nicole. We'll move on to Irene from Air News. Go ahead, Irene.
Hi, my question is for Chair Redman. Does Family Compass include resources or programs provided in the townships? And of course, I'm thinking about North Dumfries and Wilmot.
So Irene, you'd have to go on the website. My understanding is that it's pan-regional, so it should include all of those services as well.
Okay, that's great, thanks. That's it, sorry.
Okay, thanks, Irene. We'll move over to Kevin from Global. Go ahead, Kevin.
Sorry, I had to let the dogs out. So in terms of testing, it looks like we had well over 700 tests today. How long is the turnover from, so if someone tested positive out of one of those result tests, how long would it be before we would see that number on the dashboard?
It depends how quickly our testing partners get the number of tests conducted to us. Oh, sorry, are you asking about number of tests done or?
No, I'm just, so
Sorry.
if someone were to test positive out of one of those, when would we, like, there was one case positive test shown today. When would that person have been tested?
Oh, it depends on the lab turnaround time and the entire turnaround time in terms of when the person was tested and then how long it took to get to the lab, and if it had to be rerouted, if there was some additional time there, and then the lab has to run it, and then the time to get from the lab, time it takes from the lab to, the time it takes for the lab to give it to public health. So it's overall, I should be more succinct. It's overall the turnaround test, turnaround time for tests, for when somebody gets a test to when public health gets the results.
Well, I was just seeing that in provincial documents saying that it's about they're suggesting that a person will hear within 24 hours, and public health, same point, and then public health would be in contact with them 24 hours after that. So I'm just curious as to how long it takes it to make it to the website.
Oh, well, I think what we have to understand with those numbers are they could be referring to in lab turnaround times, which could be the time it takes for the lab to get it to when it gets a result. And that's only a part of the overall turnaround time. It's also an average turnaround time. We do get some results very quickly, and we do get some results that take a few days. And then in terms of when we get it up to the website, that's usually 24 hours. That's what we aim for. We aim to get it up very quickly after we are notified of the results. That's generally, I would say our dashboard is pretty much as timely as we can be for the local data. But that lab information, we have to be careful about what it actually means, right? Because it could be talking about just the turnaround time for the lab to process the samples. Depends on what it's reporting on exactly. Which will probably be in the fine print.
Okay. No, I'm just curious as to, so there has been a jump in testing since Monday. Would we be seeing those results already on the website or no?
No, I mean, we could be. Some of those results we would be seeing, but some of them could be delayed depending on how long it takes for the total turnaround time for lab results. But then once we get the results, we very quickly, or in about 24 hours, are able to put it on the website.
Okay, that's it for me. Thanks.
Okay, thanks, Kevin. So that wraps it up for round one. Does anyone have any follow-up questions? Oh, I see a few hands. Okay, we'll start with Damon. Go ahead, Damon.
Okay, thank you. My question's for Dr. Wang, and we might have covered this in the past. I just want to know the process of resolving a case and if they're required like a second test and when those are updated on the site too.
So it's not a simple answer. The guidance for what is considered a resolved case has also changed as we've learned more about the virus, and the provincial experts have had an opportunity to assess the data that's been coming in. So before, in general terms, what I can say in terms of general trends is before it was a more conservative approach. For example, you had to take a swab, for example, 14 days after the person started to have symptoms or longer. And then you'd had to have 2 negative swabs at least 24 hours apart to consider someone resolved. And now in general, except for people that have been hospitalized and some other some other situations, for the majority of cases, someone is considered resolved when it's been 14 days from when they started to have symptoms and they are no longer feverish and they are clinically improving. So that's the latest in terms of general guidance. Now, that doesn't mean that it applies in every situation. Sometimes, in some situations, for example, a healthcare facility may decide it wants to do what's called a test-based approach. So it may want to continue to take tests of its healthcare workers and ensure that they are no longer shedding the virus before they allow the person to return to work. In certain specific outbreaks, either the facility or sometimes public health may decide to recommend testing as opposed to just time passed to consider somebody who has resolved. So it's actually not a simple yes or no question. It depends on an assessment of the situation, on what could be considered most appropriate for whatever situation that is. So yeah, so sorry, that was a bit of a long answer, but it shows a little bit of the complexity. But we're moving more towards what's called a time-based approach, which I mentioned.
Okay, and then just a little follow-up. At the beginning of the outbreak, we were saying people with symptoms should just stay home, self-isolate, and they weren't getting tested. So would you be okay with an estimate on how many cases you might think would be resolved, or you can't even say that?
Yeah, we can't say it for the people that haven't been diagnosed. We can only track it for the people who have been diagnosed.
Okay, thank you for your time.
Yeah.
Okay, thanks, Damon. Tim, you had your hand up as well. Go ahead.
Yeah, Dr. Wang, with Conestoga Meats outbreak over, what are the next steps for the workplace? Is there going to be frequent visits continuing?
So they're going to continue to put in place those strict measures that they put in place after the plant reopened, and yeah, it's a facility that's also overseen by the Ministry of Labor, because it's a workplace, and so I assume that they'll continue to do whatever they normally do in terms of workplace oversight and inspections. And for us in public health, we continue to recommend that they keep those measures that were effective in bringing the outbreak under control. We keep them in place, and yeah, we'll continue to monitor cases. I expect that we will have cases of COVID-19 in workplaces, in the general public. It's not that's expected. What would put a workplace under outbreak is a situation where there is a source of continuing risk in a workplace that leads to workers becoming infected, not just the presence of cases among workers. So there could continue to be cases in different workplaces, but the important thing is that they put in the measures to prevent a source of spread in the workplaces themselves.
That's great. Thank you.
Okay, thank you, Tim. I know Joanna has a question. I see Nicole as well. Go ahead, Joanna.
Thank you. I'm not sure if this is for Dr. Wang or Mike Murray, but more stores are opening now, but just generally, should people be using that as an invitation to kind of go back to their old habits, to like pop into shops and, go out for things that maybe aren't essential?
Do you want to try, or do maybe I'll just all right. I think the key thing is we can go to those stores, but probably a lot of stores are going to have a guidance on how many people at any one time, ways to help the clients socially distance, and that's what we want to see. It's not going to be the the normal from before. It's going to be a new normal, where as a society, we have to continue to ensure that the physical distancing measures are in place. So, you know, what the fundamental message is, if people, or rather when people go to stores or go anywhere else, they need to respect the physical distancing recommendations. Wear a mask if they're going to be around other people, wash their hands. Those are the fundamental things. And you know, what businesses are going to try to do, as well as any services that are going to be opening up in the next weeks, I believe that they're going to be trying to put in place measures that will help enable their patrons to follow those recommendations.
All right, did you want to add anything? No.
Nope, I think that's great.
Okay, thank you.
Thanks, Joanna. Go ahead, Nicole.
With the encouragement of everyone to wear masks when they go out, what recommendations do you have in regards to children? Because children are now out and about with their parents as well. And, you know, do parents need to know anything about masks and sizing? Because do the masks that are being sold, are they the proper masks that children should be wearing?
Yeah, so children under 2, we don't recommend masks for them, but older children, you know, they can wear masks. Generally, the principles are the mask has to be something that fits well. It covers your nose, your mouth, allows you to breathe, right? So it's a breathable material that we want you to use, not something like plastic. So, you know, a cloth mask is a good type of material. So basically it's what fits well, what allows you to continue to be comfortable and breathe, and covers your nose and mouth, and that you can take on and off without having to fiddle too much with it, because we don't want to self-contaminate ourselves by touching our own masks with our hands, and, you know, wanting to make sure that we try to wash your hands before and after we manipulate the mask. But again, you know, it's not everyone that can wear a mask, so we have to also be careful. We can't look at people and say, you're not wearing a mask. Doesn't mean, you know, that they're doing it because they don't want to do it. But a lot of people can't wear masks. So the more people wear a mask, the more helpful that's going to be for us overall. And we're going to be able to help protect ourselves better. And so that's why there's that general encouragement.
Okay, anyone else? Oh, Kate, there you go. Go ahead.
I gotta sneak in there. Mike, the other day we were talking about summer camps, and you said that the region was still awaiting some direction from the province as to whether or not, like, how they would run. Has that been received yet? Has the region figured out what's happening?
So I think the short answer is no. I'm looking to Dr. Wang as well. I don't believe we've received from the province guidance on how to operate summer day camps in a safe way. And, you know, I know that municipalities and organizations right across the province are all wondering about the same issue. So we're really hopeful.
Well, that's good. Well, thanks for letting me know. And
hi, Irene. I think you may be on the phone.
Just fixed it. Yeah. So I think, Kate, there's like hundreds and hundreds of organizations who are awaiting this guidance from the province. And we're really hopeful that it comes out soon, because, you know, organizations will need to make decisions like really, really soon about will they be able to offer summer day camps or not? If so, how? And, you know, open up registration if they're going to be able to operate.
And I guess to add to that, and I realize that this is probably not a conversation that's been had yet, but we do have some camps that have canceled and they're not giving refunds to parents. And I'm wondering if there's any plan for the region to help out those parents who are out hundreds, if not thousands of dollars because the camps refuse to give refunds.
So I think the short answer is, you know, that would be a discussion between the families and the organizations who, took deposits and then canceled. That's not really a thing for the region. Yeah, so I know that, for example, I believe some of the area municipalities canceled some summer camp programs, and I believe they provided full refunds.
I'm done, but Nicole wants on.
Nicole, go ahead.
What recommendation would you have? I know of organized sports and rep teams suggesting that there may be potentially organized sports like soccer this fall. When is it fair to tell parents, what, just cut the cord, it's not going to happen this year? Or because I feel as though a lot of parents are being strung along, and I don't know if how to address that.
Yeah, so I can tell you, this is an issue that the area municipalities are actively working on, and they're working with their minor sports associations. And in many cases, the minor sports associations are working with provincial or national associations, who are providing guidance, like sport-specific guidance. So Nicole, there's a whole lot of work going on right now to try to come up with a good answer. I don't think anybody's stringing anybody along. I think truly the organizations are trying to do the right thing and find the right balance between, meeting the desire to have organized, minor sports, and yet trying to do it in a safe way. And I think they all have a safety first mentality. And so they're trying to figure out, can we provide this program in a safe way? And, it's a complicated issue.
Okay, so I will do one last call. No hands. So we will conclude today's media briefing. Just a reminder that next week we go to 2 briefings a week. So we'll see you back here on Tuesday, June 2nd. We hope you all have a good and safe and physically distanced weekend. And thank you for participating. Take care.
Bye.